I'm going to check the Facebook. Is it live already? Yeah, we're live already. Yeah, let's start. Okay, good afternoon, everyone. I'm Xiao Fong, initiator of Mental Health Awareness, Advocacy, and Support Group. And we have our co-founder, Zening here, and our guest, clinical psychologist from MPS Psychological Service, Evelyn and Yawan. Yeah.
Hi. Selamat Hari Raya to those who are celebrating today.
Okay.
Or tomorrow.
Or tomorrow.
Okay. Okay. Thank you, Evelyn and Yawan, for joining our session today. Yeah. Today we will talk about depression and anxiety, but as we know, depression and anxiety is a very common issue in our country. So can I know what is the figure of Malaysian having mental illness? Is that considered serious in our country?
So actually, we can actually see that in 2011, right? We actually Malaysia, right? There's this national morbidity survey, and they found that in 2011, right? So there are a lot of individuals who are express having suicidal behaviors. It's the highest among those 16 to about 24 years old. Okay, so in 2015, there's this news saying that about 4.2 million Malaysians aged 16 years old and above have mental health issues. 4.2 million, and about half of them are females. Okay, so in 2017, they did another survey again, and they find that individuals aged between, so they compare between different age groups, 13 to 17 years old young adults, and they find that among this group of people, 13 to 17 years old, the suicidal behavior is the highest among Form 1 students. So we can see that actually there is an trend that there are a lot of young adults, 16 years old and above, express having, either suicidal behavior or some mental health issues. But actually, if you look at it from the worldwide perspective, right, mental health issues or disorders will be ranked second. More specifically, depression will be ranked second after ischemic heart disease, right? So ischemic heart disease meaning to say like individuals who have their arteries blocked, right? So that is the first most alarming disorder or disease. The second will be depression. So we do see that it is actually quite alarming, not just in Malaysia, but worldwide as well.
So is the depression? Yeah.
You continue, Xiaofeng.
Yeah, Zening, your turn.
Okay. Just to inform you guys, so for people that are watching this live, feel free to comment or ask any question in our live comment. So our psychologists, Evelyn and Yalvin, will be here to answer your questions live. Yeah. So feel free to leave any questions.
Yeah, or any thoughts if you guys have, right? I mean, especially during this time, MCO, I think everyone is stuck at home, or there's any questions pertaining to mental health in general, may not necessarily be anxiety and depression. But if you guys have any questions to ask at all, yeah, just feel free to ask.
Yeah. You can also private message us, or yeah, just PM us on our Facebook page. I will ask the question. Yeah.
Okay, so just now I heard Evelyn says that 16 years old and above already have mental health issues based on the studies, right? Based on the survey done, right?
Yeah, so basically they see that 16 years old and above, there's about 4.2 million individuals who express having mental health issues in general. But we are not sure, below 16 years old, they may also be individuals, like younger adults who express having all these teenagers as well. because there's another survey that I shared earlier that between 13 years old to about 17 years old, the highest suicidal behavior are among Form 1 students. Form 1 meaning to say it's 13 years old. Yeah. So there can be, individuals even younger who has some who may be struggling with either school or family or friends. It is also the age where they transition from primary to secondary. There's also a whole different adjustment that they are experiencing as well. So those can be one of the few reasons as well.
So we can saw some questions in our comments. They asking if someone is given medication, how long before the medication will take effect? And if there's any withdrawal symptoms if one stops medication for some reason.
Okay, Yawan, you want to take that?
Okay, so basically it depends on what kind of medications that the doctor prescribed to you, and each type of medications that have their different what we call side effects for that. And it also means that it will take different time frame in order for the medication to be effective. But generally speaking, for example, if for antidepressant, it needs about at least 2 weeks in order to have the effect. Yeah. And then when you talk about whether there are withdrawal syndromes, basically, if someone who really feel like they're improving and they would like to stop, I would say that it's better to doctor because each of the medications they need different way of stopping, as in they couldn't stop from a high dosage to totally zero dosage. It need to go through some period of time by phase. Maybe the doctor will slowly cut down the medication dosage and then put under the observation and see whether our body can actually adjust it to it. Yeah, I think maybe Evelyn can add a little bit more about that part.
Right. So yes, again, like what Yawen shared, right? It depends on what medication the person is taking, and also it depends on as far as I understand, it depends on the dosage as well, right? So, for instance, if you're talking about depression, normally once the psychiatrist give you the medication, they will most probably would like to see you 2 weeks after that. Okay, reason being is, of course, apart from the side effects, most people with antidepressants, the most common side effects that we know is like dry mouth, you feel very thirsty all the time. Some people, they feel tired, giddiness, headache, or nauseous. If taken in the long run, they may even experience weight gain for certain medications, not all. Okay, so after 2 weeks, if you go back to see the psychiatrist, then the psychiatrist will most probably ask you, how are you doing? Then do the adjustment. Now, when it comes to stopping medication, most of the psychiatrists that I work with wouldn't want their clients to take medication forever and ever. But again, disclaimer, depending on the type of illnesses that this particular individual have. Yeah. And of course, if let's say when it comes to stopping medication, the psychiatrist will taper down. So after taking it for a while, then taper down slowly, gradually. Typically, how long to take that medication? Again, different people's body would react differently. But generally, it will take 3 months to 6 months to see the effect. That's why some psychiatrists, they will recommend like a longer term kind of treatment. After 2 weeks, you go back review. Then after a month, see how it goes. 3 months down the road, check in again and see how, okay, if everything's okay, then maybe slowly taper down. So generally 3 to 6 months. But again, disclaimer, depending on the seriousness and the issues presented, the disorder. So different people would work differently. Yeah.
Okay. There's a question here from Adiza. How do you deal with someone with suicidal tendency who has refused to seek help?
This is a very, very popular question, right? Like we do receive a lot of people actually asking if friends and family around me, and I don't know how to get them to seek help, right? So there could be many reasons why this particular individual refused to seek help, right? So before bringing them in, I would be interested to know what is the thing that is stopping them from seeking help. Yeah, so for instance, if let's say if I'm depressed, right, I may be afraid that I will be judged. I will be afraid that I don't know how people will look at me, or if they think that I'm useless, that I can't cope with my stress. Or is it because I think that going to see a psychologist or counselor, meaning I have to take medication, right? So these are very realistic fears. So before a person could be able to receive help, we must first perhaps establish and see what could be one of the reasons, and whether we can help this person to find out all this information, and to also explain to him or her that, okay, seeing a counselor, psychologist, a psychiatrist is actually different. You see, this person doesn't mean that you have to take medication. So try to normalize that. And at the same time, this is what whenever individuals with depression and their family members come in, right, they will say things like, oh, they don't understand me, they don't know what I'm going through. So sometimes, as much as we care for this person, we really, really want to help this person go through these difficult times, a lot of times we notice by giving suggestion, problem solving, by us jumping into problem solving mode, may not necessarily be helpful for that particular individual who is still contemplating of reaching out to seek help, right? So one of the things that you can do at this point is actively pay attentive to what he or she have to say, and also listen to what they actually want to say. Now, listening is not through just our ears, but through our heart and what we see as well. So maybe we can say things like, instead of asking, do you feel sad? It's a close-ended question, right? So maybe we can open up to, people and ask them, okay, so how are you feeling today? How can I help you to feel better today? What are the things that you want to do? And perhaps, I can do it together with you. And when that person is ready enough, you think, maybe we can also offer ourselves, right? Maybe, I know it's difficult to go through this by yourself. And if you want and you're comfortable enough, I can actually go with you too, right? So saying all these things to make them feel supported as well. Anything you want to add, Yawen? Can't hear you, Yawen. You're muted.
Yeah, muted.
Sorry. Okay. I think Evelyn brought up a very good point, and at the same time, I think another way that we can approach to these issues is we try to switch our role to the other person perspective. As in, we can ask ourselves, one day if I suddenly feel very sad, very demotivated, and at the same time I'm not sure what happened to myself, and I'm not sure what will I be receiving if I really go and seek help. So a lot of uncertainty, a lot of fears that happening inside us. What are the things that I think other people could do to help me feel better, to reassure me, so that I'm willing to go through this? So some of the statement that Evelyn shared just now would be very helpful. And at the same time, it also shows that the trust, sometimes as a person who going through difficult time, we might need some time to gain the trust, to gain the reassurance. So in that case, if we really, as the person, really want to help someone around us, someone that we love, but going through the depression, going through the suicidal ideations or that, maybe we need to give them some time, but it's not like we sit down there passively doing nothing. We constantly show support to them, but not too pushy, as into sending a clear message to them that whenever you need me, I will be here, but I will respect you, respect your pace. So when the person slowly feel that, people with depression doesn't mean that 24/7, 7 days, 24 hours, every day, they have same intensity level of depression, same intensity level of low motivation. Sometimes at certain time, they might feel slightly better. And if we are showing that support to them when they reach that stage, maybe there are higher chance for them to seek help from you as a friend or as a family first. And then from there, you can slowly let them know what is the things that they can expect by receiving treatment or that. And sometimes some of my clients find very helpful if you tell them that, you accompany the person to seek help together, as in they don't go through themselves alone. You help them to make appointment, you accompany them to go there and then to be with them, to show that the stigma is not really as negative as they thought. And we as a person, as a friend, as a family are willing to be there throughout the process. So this is the first point I would like to add on. And second point that I would like to add on would be like, although we want to support the person in front of us, whether they go through a very difficult time, but we also need to make sure that we have our own self-care. So we also cannot put ourselves in a position that we are like 24/7 ready, and to the extent that we lose our own health, own time. So in that case, slowly we can have another person to be in to support each other in that sense. So depression or psychological disorder is not like 100-meter competition. Actually, it's a marathon. So it takes time. So we need to strategize. We need to really think it from long term. How can it be effective? Yeah, these are some of the things that I could share.
Right, thank you, Yao.
Okay. All right. So here's another question. How to deal with depression when you are alone? And is depression bad for your mind and heart? Evelyn, you're muted.
Amil as
Thank you for letting me know. Okay, so I hear that there's two parts of the question, right? So how to deal with depression alone, and if depression is bad for the mind and the heart. I'll answer the second question first. So there is actually a biological explanation to depression, right? It is not just purely like what most of the people would say, it's all in your head, it's all in your mind, right? A person can develop depression due to many, many, many different reasons. So for instance, if you are right now a working adult, right, and you are staying by yourself, a person can actually feel depressed when they don't have that kind of social support, when they're alone at home, and when they're working, they're so stressed out at home, at work, and yet they have to also take care of themselves. They have to cook, they have to go seek medical services by themselves. So there can be many, many reasons to how depression can possibly develop. So would it be bad for your mind and your heart? I would say that depression, if we talk about depression, there are many different levels to it, different severity. It can be mild, moderate, or severe. But if you find yourself in a situation where you really don't feel motivated to do anything at all, you feel tired all the time, you just feel very sluggish, you cannot concentrate, you can't eat, you can't sleep, to the point where taking care of yourself has also become like a chore, right? It's like you're dragging yourself to do it every day and you don't know why you're doing it. Or to the point where, you just feel that life is not worth living anymore and you just want to end it all. This is when I would really consider that, it's important to reach out to seek for help, right? Having depression, it doesn't mean that you are crazy or, you are out of your mind and things like that. There are ways to actually manage it. Treatment is available. So how to deal if you are facing depression alone? There are a few methods when it comes to intervention, right? So first one is either through medication, the first one, and the second one is through psychotherapy or counseling. According to research, combination treatment is the best option as compared to just going to either one of it. But again, it depends on the severity of the depression that you are experiencing at that point of time. Yeah.
Okay, I think I can add on from that. When we are dealing depression, when we are alone, sometimes what we experience is I feel super hopeless, and then I have no motivation. I don't know what to do. I rather just sleep through all the day. And then when we do that, we found that okay, this is the first day I doing that, second, third day, and it become forever. All right. So what we can do is, like I said previously, one of the solutions that I actually recommend to my clients is there are certain period of time when our depressed intensity level is not that high. So that is the moment that we scroll through our phone, scroll through our contact, and see who are the persons that we really trust. And we think that when I'm very down, when I talk to this person, it can at least make me feel better. So when you scroll through that contact, you identify one or two person who really think that you can trust them during the time that you're not so depressed. Send a text to them or contact them and say that I have something to want to say to you. So sometimes my life might have some difficult moment where I need someone to be with me, talk to me. So if that is the moment like that, can I actually contact you? So when we actually send our request to these people who we really trust and they're also willing to help us, then we get their permission. After we get their permission, we will know that the next time when I am at the stage of very, very low, I don't have to be alone and I don't have to worry about now I'm going to contact people, but they might not be uh, wanting to talk to me or that because we already get the permission from one or two friends or family that we really trusted and that really care for us. So they'll be there for us. Then always remember that depression, psychological disorder is not something that you have to face it alone all by ourselves for all the time. All right, we can actually get some support. Yeah.
I think one thing to also add on to what you shared, Yawen, I think support, is always very important because yes, a lot of individuals, shared that facing depression is like, you're facing it alone and no one could ever understand. Well, understand that many different people can be depressed due to many different reasons. Your reasons and my reasons can be different as well. But yes, do know that you do not have to go through this by yourself, right? In fact, I know Xiaofeng and Zhening, you guys started a support group for individuals with depression and anxiety. Maybe you guys want to share a little bit more so that our audience here know that what you guys are doing as well, because it is an amazing initiative.
All right. We started to form a group. As you all know, before that, our page is called Mental Health Awareness, and now we change it to Mental Health Awareness, Advocacy and Support Group. Then we have our first talk few weeks ago, and this is our first Facebook Live, so I'm a bit nervous. So I'm so sorry about that. Okay, then we try our best to book as possible as we can. We just want to form a support group that long run that support no matter is a caregiver or patient itself. Because I know that people living with mental illness is not easy, and sometimes it's feel alone, but we have to stand up after we fall down. Yeah, so I formed this group to just want to support, and we just it's the beginning, so we will try our best, get feedback from any others NGOs, then we will like do as much as we can.
That in 2011.
Zening, you want to add on?
Zening can hear you now.
Okay, so yeah, like what Xiaofeng says, so we actually formed this group is to help people that have maybe questions or doubts in how to identify, or maybe they are looking for support for mental illness. And yeah, because maybe there's not much support out there, so that's the least we can do lah. And we will hold this kind of sessions or webinars from time to time. So if you guys are interested, we'll do more in the future, and maybe later on we'll send out a survey form, and you can maybe leave some questions, or if you want to get to know more notification from MHAAS, which is the group, the name of group. Yeah, feel free to leave down your question and also maybe your email, so we can get you notified for the next session. Okay, so yeah, that's basically what this group is for, to form a support group for everyone. Okay, so yeah, next question is, okay, there's someone asking, how about those who take medication without prescription? They are not clinically diagnosed but self-medicate based on recommendation from friends. Okay, so any advice on this question from Evelyn or Yalvin?
Okay. Yalvin?
Maybe I would like to start from, even though person A and person B, both of us are having same diagnosis, both of us are having depression, doesn't mean that the medication that effective for us will be the same. And from the question itself, it's like they are not even clinically diagnosed, but they do the self-medications based on recommendation for friends. I would say that it would be quite dangerous in a sense, because we don't know the type of medications that maybe person A take will be effective, but the side effect or the impact on our body will be really, really different. And whether they have some other, let's say, physical or health issues that will make the complicate the entire situation some more. So in that case, what I would say is like, it's better not to do that. Always consult the professionals, because there are more complications behind. Yeah, I think Evelyn can add on from there.
Yeah, I think that's a good question. You take this example, right? So imagine if, let's say, me and you, right? We both are diabetic, okay? And I tested my glucose, that my blood sugar level is this level. You tested yours is another level. So both of us, we are diagnosed with diabetes. But whether or not the treatment is the same for the both of us can be very different also, because the treatment for me will take into consideration my overall health, whether I have other medical condition or not, right? The treatment for you can be different because of the reasons stated above. So if, let's say, you take those 100 mg of those, and I take 100 mg of those, it may not be sufficient for me, or it may be too much for me. Yeah, so even though we are both diabetic, but the management can be very different considering other factors as well. So the same thing with depression or anxiety or any other mental health illnesses. It is actually the same concept. So the treatment for me, the dosage of the medication, the effectiveness can be very different for me as compared to you. And some medication, it is not advisable to be taken by some individuals, perhaps with, let's say, I have heart disease, and there's some antidepressants perhaps that it's best for me not to take. But if, let's say, I didn't seek or go see the doctor, I may not know about this, and perhaps it will cause even more harm for myself. So the baseline is always good to have it checked out and speak to someone, a psychiatrist or a clinical psychologist, to get yourself diagnosed if you want to, and seek the necessary medical attention.
Okay. I have a question here. As we know, having suicidal thought is one of the signs or symptoms of major depression. And should we, as a friend or family, should we talk about suicidal thought openly, or will this trigger someone's suicidal thought if we initiate the topic about suicide?
Very good question as well. So I would like to use another analogy, right? Today's analogy day. So I'd like to use another analogy. So if let's say I like to eat petai, and Xiaofeng, you don't like to eat petai. So today I ask you, hey Xiaofeng, you want to eat petai or not today? Do you feel like eating petai or not? You definitely say no, right? A few days after that, I ask you, hey Xiaofeng, you want to eat petai or not? Then you'll be like, what is wrong with you? Why you keep asking me you want to eat petai or not, right? So using this concept, think about if, let's say, a person who is not depressed, just like don't like to eat petai. If you ask this person who is not depressed, are you feeling suicidal? This person will be thinking, why you ask me this question suddenly? And even according to research, if you ask individuals who they are, not depressed, they are doing okay, if you ask them this question, you follow up again after a while, they are most likely not report to feel depressed or having suicidal thoughts. Okay, but if a person who is already depressed and having suicidal thoughts, often than not, asking this question will actually make them feel, in a way, understood, and that you have heard some of their struggles or experiences that they are going through. So the answer is, if a person is not depressed, is not feeling suicidal, by asking this question, it is not like to say to plant this idea in their head. You can actually plant it. But if a person is experiencing all these difficult emotions or feeling suicidal, asking them this question can actually make them feel understood. And if they say yes, at least, by going through it with them, you can bring them to seek the necessary treatment available.
So there is a myth, I think. Most of the people that don't understand depression, they might say that person having suicidal thought because they are weak or they are too negative. So is it true?
Come again. So your question is whether
they labeling a person who have suicidal thought like they are weak and they are not strong enough to facing the problem they're facing they have. So is it a true one, or I think this is a myth, right? Yeah.
right. So whether having suicidal thoughts means that they are weak, they cannot face all these problems. This is my experience so far talking with individuals who are depressed and suicidal, right? So most of the time they say that it is not exactly that they want to end their life, but they just can't stand with the pain, with all these suffering, and they just want to end it, right? So it's like, if I end my life, I don't have to give more burden to my family, for example. I can elevate that. With ending my life, I can actually, make others not worry for me so much. I don't feel like a burden. A lot of individuals who express feeling suicidal is that they want this feeling to be gone. Not necessarily that they want to die or end their life per se, but they just want all this pain to be over, right? So Yawen, he worked in suicide hotline called Lifeline. And I believe, when you receive a lot of all these phone calls from callers as well, perhaps you can share a little bit more as well.
Okay, so normally what I would share with them and also the public, because just now cell phone talk about whether it's weak. If we talk about suicide, we want to end that. It means that our mind is not strong enough. So I always tell them, okay, imagine that we are in this race, okay? So there another 100 meter for us to finish the line, and these two persons are running, all right? And then person A is like, okay, I'm going to run, I'm going to cross the finish line, and I'm going to win. Then the second one say, I cannot anymore. I need to stop now. I need to stop now. And then the person around, all the crowds around the person B will say that why only another 100 meter to go in order to finish the race? Why you want to just give up now? Why now? Right? You're so weak, and then you don't know how to appreciate what you have. But imagine if the person A, he just started to run. Of course, he have a lot of energy. He can go full force, sprint all the way towards the finish line. But what if the person B, the person already run for a very long time, plus there are a lot of burden. He has been carrying bags and then carrying all the textbook, and after that, he might be injured his leg or that. It's all these things we don't see it if the person never tell us. Then now you tell me, is the person B is weak enough to so-called give up in that sense? Actually, it's not really that way. So we do know what kind of burden, what kind of life difficulties that they have been going through. Just imagine if I'm going to hold one phone for 10 minutes, I still feel okay. 20 minutes, still all right. But 1 hour, 2 hours, our hand will feel very pain. Our muscle will start to feel pain. It's not because of the phone itself is very heavy, because we are holding something for too long. So in that case, to answer the questions, I will always say that we don't look at the issues at the surface level. We always try to understand more what is happening in this person, what caused this person feel like he can't take it anymore. And if there are some burden baggage, then we see whether help from there or not. So it's not a good way for us to really jump to conclusion that, you see, I can do this. Nowadays, there's a lot of people who say nowadays a youngster or even a student, they are like spoiled brat, then they cannot take stress. And in our time during the past, then we take a lot of stress compared to them, but we still go through. But why they cannot? So it's not a contest that we can compare. Yeah.
Okay. Okay. Let's move on to the next question. So, yeah. So, in depression, anxiety, and illness that exist only in the 19th or 20th century, because like we don't usually heard about this illness back in the days, right? Like from our grandparents' days, we never heard of them talking or mention about depression or anxiety. So, is this something new?
So actually, mental illnesses is not exactly something new, but I guess back then, even in the 1800s, right, people would relate, and even until now, people would relate it as witchcraft or demonic possession, right? You will go prayers or call bomo and things like that. It's actually it's not to say uncommon, right? Back then, perhaps compared to right now, with with technology, with definitely a lot more stresses experienced by many of us, this could be one of the reasons why more and more people are expressing having depressive or anxious thoughts, or feeling more stressed at work. And right now, even for myself, looking at my two baby nieces, right? One is standard 3, one is standard 5. When I spoke to them last week, right? They told me that the elder one actually told me that she got bullied in school, and the nasty things that their peers say to her, And kids nowadays, they also have a lot of interest to do, like say TikTok or learn Korean, learn certain dance, the competitiveness, right? As compared to my time when I was in primary, things like this is not so intense. So just, the change of say 20, 25 years, there are so many different changes in terms of the social, cultural kind of structure. So I would say that with all these changes, with people feeling more and more stressed out, this could be one of the reasons why right now we hear and see more people reporting having all these difficult emotions.
Okay.
Okay. Yeah. Okay. So there another question is can normal people, normal human beings, get depression and anxiety?
When we talk about normal human being, does it mean as in only abnormal people will get depression? So let us think from another way. It's like, can normal people get flu or normal people get fever? Or does it mean that people who get fever and get flu, they are not normal anymore? Yeah, so I would say that based on the research, worldwide research, or we just focus in Malaysia, there are almost like 29.2% of Malaysian population having some stress, anxiety, and depressive issues, difficulties in our life. So about 30%. So can we say that all of us are not normal in that sense? So I think the questions that we can ask would be like, how can we protect ourselves from all these life challenges, and then we get into depressive symptoms and having low motivation and stay there. All right. So I think that the questions that we can ask maybe is like, if we really have that symptoms, if we really going through the difficulties, what are the things that we can do to actually get up from there? Yeah, so to answer your questions, I would say that everyone have some chances to go through the bad times at our life, and some of us will deal with that in a more positive way. Some of us might be not dealing it very well, maybe because of, like what I said previously, we have some extra burden, extra baggage at our back that make us more difficult to deal with the current situation compared to others. So we don't blame ourselves, but we constantly look for resources. Can it be within ourselves, the internal strengths, or the resources that we can get people around us who can help us and walk through us? Because remember, there's no single person who don't need any help from the day that they were born until they pass away. Might not have some period of time where they need help. Yeah, so we think it that way, that maybe we are more willing to see the positive side of it and get help for that. Yeah.
Okay, thank you, Yawen. So next question from our audience: how to seek for help? Some people do not know and afraid to come forward. Me neither. Do we have to go to the hospital or what? People who I know, they just with anxiety and depression for weeks, they're just thinking negatively.
That's a good question. So how to seek help? And I'm guessing the question here is also, if seek help, then how to seek help as well, right? So to address your question, if let's say a person who is going through these difficult times, right, it is no doubt that one will be feeling very scared and afraid to come forward, right? These are very, very normal kind of reactions. And this fear can also come in many different reasons. Apart from the stigma that I mentioned earlier, the second part is also don't know where to seek help. Yeah. So I would say that the first part, if let's say you know of someone who is struggling to seek for help, my advice is to talk to this person to understand again what are the challenges that he or she is experiencing. And if it's for yourself, try to identify what are some of the difficulties that you are experiencing to come forward. Is it because of lack of information? Is it because of, you're afraid that no one is there to support you? If, let's say, you wish to have someone to do this together with you, would it be possible to reach out to, friends or family individuals in your phone book, like what Yawen mentioned earlier, to seek help together with you? Now, how do we then identify whether it's anxiety or depression, or if it's just normal stress, right? So for us at our own center, we have received quite a number of people who come in to just want to identify their stress level, their anxiety level, and depressive level. But it doesn't mean that they are clinically depressed or anxious. So we do this free kind of stress screening for these people to at least let them understand, okay, how do you then identify further? When are your warning signs? What you can do? For you out there, if let's say you are uncertain, if possible, try to speak to, let's say, a clinical psychologist first, if let's say you don't want to see a psychiatrist for medication. So generally in our field, there are 3 different professions that people will seek help from. Psychologists like myself and Yawen, a psychiatrist who is a medical doctor, and a counselor. So what are the differences between these 3 professions is that a psychiatrist, they are medical doctors. They graduate in med school, then they specialize in psychiatry. Okay, so that's why this is the reason why they can actually diagnose and give medication. For psychologists like us, we graduate with a bachelor degree in psychology. Then we pursue our master's in clinical psychology, right? So for counselors, so for us, we can diagnose, but we can't prescribe medication. For counselors, some of them, they graduate with a bachelor degree in counseling or a master's in counseling. They can do therapy, counseling, just like us, but they can't diagnose. So if you're uncertain whether or not you need medication, you want to assess whether you have anxiety and depression in terms of the clinical side of it, you can actually make an appointment or speak to a clinical psychologist to see whether you are clinically depressed or anxious. And if, let's say, that psychologist assess you and think that, okay, you are in this moderate, mild, or severe range, then you can plan together with the psychologist on what would be the best next option or treatment. Usually, if a person is severely depressed, then the clinical psychologist may refer you to see a psychiatrist, especially for those who have difficulty sleeping for a very, very long time. And we know that when we can't sleep, it will really mess up on how we feel, how we do things, mess up on how we are able to concentrate. So one of the best option would be you can see a clinical psychologist. But if, let's say, you think that you want to see a psychiatrist, the normal procedure, if you're going to go to the government hospital, is that you can go to any of the clinic, private clinic or clinic kesihatan. Okay, you can get a referral letter from the doctor, and with that letter, you can actually go to see a doctor in the government hospital. So that's when they will assess you again and they will prescribe medication if you need to. But if, let's say, you're going to see private, then you don't necessarily need to have this referral letter. If you come and see us, clinical psychologists, you don't need a referral letter as well.
So I want to add on a little bit. So some people might feel like I'm unsure what is happening to me, and I'm so afraid to go out and seek help. So what can I do? So maybe we can start from some minor steps. For example, there are a lot of free helpline and NGO that actually provide some free emotional support. Let's say befrienders will be 24 hours or that. So maybe you can start from calling them and it remains anonymous. So in that case, you can try to talk to someone and maybe they will help you to process some of your thoughts and feelings. Then after that, you have a clearer picture on where am I now, whether I should seek for the next level of help from professionals. So it can actually help you from there. Yeah, this is something that I would like to add on.
Okay, so I found that nowadays many people around us, like I have say with me, like talking about I have depression and I have anxiety, but actually what is the difference between depressed and depression, anxious and anxiety?
So feeling depressed, when we say the word depression, right? I'm feeling very depressed today. We often use it very loosely. Yeah. Like today I'm feeling a bit sian, I feel a bit low, then I say that I'm feeling depressed. But feeling sad, feeling depressed versus clinically depressed is actually very different. Okay, so one of the good way to explain is like this. So imagine this is sadness, feeling depressed. This is a person who is clinically depressed. Okay, so normally when we feel sad, when we feel depressed, really low mood, it is usually a way on how we cope with certain situation. So for instance, today I got to hear that the number of reported cases has increased again, for instance, right? So I feel sad and I feel a bit sian, a little bit lower than usual. But this feeling should go away after a while. So it should be short term. And that is completely normal. It's a normal reaction to feel sad. It is normal reaction to, feel a bit, beaten up. But if at a point where this feeling prolong to a longer term, to say 2 weeks, you're still feeling that way to the point where it is affecting the way you take care of yourself. For instance, you can't sleep, you got no appetite to eat. It has affected to the point where you are unable to focus, you are unable to, you feel demotivated most of the time for 2 weeks, then that is a time where there is a possibility that you may be clinically depressed. But again, it is best to get this assessed by a professional, so either a psychiatrist or a clinical psychologist. Same goes for anxiety too, though. Like you're feeling anxious, and a clinical diagnosis like anxiety disorder, it is also very different. So same concept, you feel anxious when, let's say, you go for an exam. You feel very scared and anxious, you scared you fail, right? But once the exam is over, then you may feel like this sense of relief is short term. But if this fear is affecting you at a longer period of time, for weeks and for months, to the point where you can't function, till you can't sleep and all, and that is when it could be a little bit alarming, and best to get yourself speak to someone professional and see whether there's anything with that.
Yeah. So just now, Evelyn, you have mentioned that psychiatrists and psychologists both can diagnose depression and anxiety, right? So how are depression and anxiety are diagnosed?
How they are diagnosed?
Yeah.
Okay, so for depression and anxiety, most of the time the clients that I've been seeing, usually they come in to see me, they usually present with symptoms of depression and anxiety. It's like abang adik. Okay, why is that so? Because depression and anxiety basically, it's all of human, we are all regulated by these different neurotransmitter or hormones in our body, right? So when there is lower hormones or certain hormones, then it may trigger to make us feel depressed and anxious. So generally, how do we diagnose depression? There are a few things that we will look into. For example, if you've been crying most of the time, you feel very sad, very low, you feel very helpless, guilty for no reason, you feel low motivation, you feel like you don't want to do anything, you don't want to talk to people also, you have a lot of negative thoughts, sleep is affected, unable to concentrate. Some people may even express having suicidal thoughts or attempted or have a plan. So all these different symptoms that I've listed, apart from screening all these symptoms, we will also ask certain history from this particular individual. For instance, whether any family members have this issue as well. We will take all this into consideration. Okay, so for anxiety, there are many different types, but generally people with anxiety, they may experience a lot of physical symptoms. Okay, so for instance, they have headache, blurry vision, difficulty breathing, their mouth feels very dry, their throat feels like there's a lump here, their chest, they feel tight, having problems breathing, their heart palpitating most of the time, their hands are shaking, feel very numb, body aches. Some people may even experience diarrhea or constipation. Okay, so you can see the difference between depression and anxiety. Depression is more like, you feel very low, you feel very sad, you withdraw, can't sleep, can't eat. Whereas anxiety is more of all these different physical symptoms.
Okay, so all right. Another question is, can you be depressed and happy at the same time? Because it sounds like two different or opposite feelings. So can someone be depressed and happy at the same time?
I'm thinking maybe because we are so used to use the words of depressed to describe our feeling of sadness. So in that case, so people might get confused. But maybe what I would answer is we can be sometimes feeling sad and sometimes feeling happy. These two emotions can coexist in the same day, all right? But when we talk about clinically depressed means if it's severe enough, we don't have the ability, or it's very difficult for us to feel the happy feeling, happy emotions. So in that case, if let's say your question is asking about whether someone who is clinically depressed can feel a lot of happiness, maybe depends on the severity level. But if you're asking from the general point of view, as it can someone sometimes feeling sad, someone feeling happy, and I would say that yes, we can feel that way. So I will pass this to Evelyn as well.
Can a person feel happy and sad at the same time? I would say, yeah, we are not limited by just feeling happy the whole day or sad the whole day. And I'm not sure if you guys experienced this before. I personally have experienced this during this MCO, right? Where I feel happy, I feel frustrated, angry, and sad at the same time, a lot of mixed feelings. And I don't even know how I feel sometimes, right? And I think it is okay to feel that, right? But if you're asking about, feeling happy and sad, like you can identify there's a pattern sometimes. Sometimes a person, if they are very, very happy, maybe they will, go out, they go all out and buy stuff, spending a lot, doing a lot of risky behavior. And then sometimes when they're sad, they stay at home, they cry, they don't feel like doing anything, they feel depressed. There's this situation or disorder of what we call as bipolar. Okay, but again, bipolar is only diagnosed when there is a cycle. Okay, so maybe within weeks or months, you will feel like high, like this, everything is very good, but at the same time, you also feel like you don't need to sleep a lot. You keep doing a lot of different things. Okay, and you feel like very excited to try many different things, to the point where it's also kind of affecting your health as well. But when you're going to the low side, the depressive side, where you don't feel like talking, you feel sad, And if you notice that there's this cycle, or you notice that people around you have this cycle, perhaps it is also time to, reach out and see or get more information to see whether this is something that is concerning. But if you're sharing about day to day kind of happy and sad, I say, yeah, we all would feel that. And it's normal to feel that.
Okay, so I have a last question here. Yeah. As we know, there are a lot of stigma and labels and also discrimination against mental illness. So how can we, what can we do to reduce the stigma and also change the perspective of people looking at us like they are keep labeling us as like crazy or something negative, negative things.
So how to reduce stigma, right? The
Yeah.
question. The funny thing is, right, like when I first entered, got into my master's, the reason why I want to enter this field is really to reduce, like what you mentioned, Xiaofeng, to reduce that stigma. But I believe, through this should be a long term, and it will be a long term thing, right? That, educating the public about mental illnesses. Actually, when we talk about health in general, our health, right? It's not just about physical health, but it's also about mental health. But when we talk about mental health, then the feeling is very different associated to it itself already. Yeah, as compared to physical health. So, how do we reduce stigma? I would say education is a way to go, but also, efforts in reaching out to friends and family to understand what is exactly, depression, what is exactly anxiety is another way. So I don't think there would be a quick solution to this, but it should be an ongoing effort. So that's why we hope also that the public would benefit from today's session, that mental illnesses, mental disorders, it is not something that should be taboo, right? But actually, it is actually part of our health. Physical health and mental health both contribute to our overall health. Yeah. Yang, you want to add anything to that?
Yeah, I'm thinking, right? So, the mental disorder or mental health, people will have the negative view on that. So maybe sometimes it depends on the words, the terms that we describe. So maybe we can see psychological disorder, psychological illness, or even some terms that is less stigmatized, less labeling. So let's say emotional difficulties or that. So whatever that we are saying, always remember that mental illness, psychological disorder, all this is not something that we can choose to have or choose not to have, just like the physical illness. So just like cancer, it's not like I can choose I want to have it, I don't want to have it. Sometimes it happens because of life, because of different reasons. And if we are able to understand that, then we can be less judging to the people around us who are actually suffering from this psychological disorder or mental illness. So it's not something that they choose to have, but they are really putting a lot of effort in fighting and overcome, and then they really want to get back to their life. Just that at this period of time, they might need a little bit more support from all of us. So always try to empathize with other people, as in try to understand more what are they going through emotionally. So sometimes show more support, sometimes spend some time with them. So I think this could actually help us, because just like the pandemic now, there's no single hero here. Everyone is a hero. Everyone is trying to do their work, do their best to actually uh, bring a better world in that case. Yeah. So it's everyone's responsibility.
Yeah, I like how you say that it's everyone's responsibility, really. And I believe, same as going through this pandemic, right? If we all join hands and understand more, listen carefully, and that itself can really make a lot of difference.
Yeah. And one more thing, right? I'm not sure how many of you actually experiencing this, but during this pandemic MCO, some of us actually experience some unexplained emotions, like very complicated. I don't know what happened, but I stay at home for 5 days, 7 days, 10 days, and then suddenly I become a little bit of, I don't know, irritated and unstable, all that, but it's nothing much happening in me. So a lot of these unexplained emotions could be a way for us to understand more about people who are going through psychological disorder or mental illness. Sometimes it's not necessary that it can be explained. It's just that when we are put into that situations, it's a very, how I put this on, understandable reactions, automatic reactions from our body. Yeah.
That's what makes us human, huh? Mhm. Can't hear you, Janine.
Hey, sorry, bad habit. Okay, so I think that wraps up our session today. And if you guys are watching this after our live session, uh, so if you guys still have any question, even though we are not live right now, it's the end of the live, you still can write write your question inside the Google survey form in our comments. I just posted a link. It's at the bottom. So yeah, if you have any feedback, any suggestions for improvements, or any questions, yeah, feel free to fill out the form. We will be answering those for next session. And so yeah, and thank you. We want here to thank Evelyn and also Yao Wen for our speaker this time. And
Thank
it's an
you.
it's a very we feel very privileged for them to spend this time to answer this question from our audience. And all right, so any add-on from Xiaofeng?
I think I want to say something, is it?
I think again, thank you so much for spending the day evening with us, showing your support to really want to understand more about mental health. And then if you all feel like you all need any extra information or need some help or need to know about how to access mental health services with with an affordable price, you can always reach out to our Facebook page as well. All right, and thank you again for Xiaofeng and Zhening for hosting this.
Thank you, Yawan and Evelyn.
Thank you.
Thank you.